I'm now joined by a very special guest who has been guiding us every single day since the break of this pandemic, informing us on how to keep safe and move forward together in combating COVID-19. It's a pleasure to have on the show Canada's Chief Public Health Officer, Dr. Theresa Tam. Dr. Tam, good morning, and thank you so much for joining us on CTV News Channel. A very happy Canada Day to you.
Happy Canada Day to everyone.
Thank you so much. And thank you for all that you've been doing for us here in the country relentlessly every single day and helping us come this far, Doctor. It's almost 4 months. We are in this pandemic and almost 6 months since Canada had its first case. Dr. Tam, are you satisfied with the progress we have made with COVID-19?
Well, there's definitely a cause for some celebration on this Canada Day, but just remember that it has been a hard journey. Many Canadians have worked really hard, staying together, stronger together, sacrifices in their own way to help us control this epidemic. Many people have lost their lives, and we must remember those lives lost, those who are working on the front lines. So together and working together is how we actually have managed to control this first incursion of the pandemic into Canada. Right now, overall in Canada, we have passed the peak of this first wave, and we're well on our way down the other side of the curve. But the virus is still with us, and so we cannot let our guard down.
Back in March, Dr. Tam, had you anticipated that July 1st will also be under the cloud of COVID-19?
Well, at that time, we didn't know too much about the virus. We're constantly learning about it, so it would have been difficult to predict. But because this kind of virus, we don't have a vaccine, we don't have specific treatments for the virus. So under those circumstances, we know that this is a marathon and not a sprint. So I think it's not that surprising that this Canada Day is actually quite different from what we have been able to do and to celebrate together previously.
Right, and on Canada Day, and 6 months since the world became aware of this virus, what have been the challenges for Canada in fighting with this pandemic?
Well, it's quite difficult to fight as an enemy that is quite invisible. This virus has, as we learned over time, has the ability to transmit even if someone is asymptomatic. So we learned that over time as well. And I think the most difficult aspect of the impact to Canada are the significant severe illness and deaths to our elders, our seniors, who are, of course, the keeper of our history and our culture and our memories and everything. So that has been the greatest challenge in Canada: long-term care homes, seniors' homes, but also other more vulnerable populations who are living, for example, in crowded or congregate settings.
That's right. It's been the most tragic where the death toll are concerned, Dr. Tam. But, you know, you've been saying all along, since so many months of coming out in the media and speaking with us, that our response has been evolving to this crisis. Now, we know that face covering or wearing a mask slows the spread of COVID-19, and several GTA cities are looking at making masks mandatory indoors. But it's not universal yet. Do you believe, Doctor, that there should be a consistent strategy, a consistent messaging in place for effectiveness and avoiding confusion?
Well, I think, again, the science has evolved. We learn more about transmission from people who might be asymptomatic as well, or just before they have their symptoms. So we know that keeping your physical distance is the best, but often that can't be done. So I think from my perspective, it's not a matter of yes or no to wearing masks. It's yes to wearing masks. It's just a matter of where and when. So listen to your local public health, but certainly any time that you can't physical distance, wear a mask.
Okay, so when you can't physical distance, certainly wear a mask. Now, based on your calculations, Doctor, and the risks involved here, the efforts being made by Canadians in fighting this pandemic, what are your estimates? Where will we be with the virus, say, 1st December, 6 months from now, do you see multiple spikes? Because you started saying the first incursion. You started in your first answer saying the first wave. Do you anticipate a second wave? And where will we be with vaccine trials, etc.?
So right now, as I said, we've worked really hard and we're well down the sort of downward side of that initial wave. But I think the best way to think about where we're at now and where we'll be is that right now, the virus is still in Canada, it's still with us. There are hotspots around the country. It hasn't left. So what we will see as the country reopens, people begin to go out more, maybe go back physically to certain workplaces, we will see resurgence of cases. The key is to sort of jump on those cases and find the contacts, act really fast, do good testing, and keep those numbers down. Now, as you've seen, I think probably around the country, in the last weeks, there's been outbreaks associated with family gatherings, with nail salons, with certain even condominiums. And so, any kind of those kind of increase in interactions is going to lead to cases. So we are looking at this as the best case scenario is a series of these little bumps that we can actually manage to control across the country. However, I don't have a crystal ball to say what might happen. What we're trying to do is prepare for the worst, which is the potential for the resurgence of this virus in a bigger way.
Right. And Doctor, you just spoke about family gatherings. Today is Canada Day. We know this day has always been marked with big celebrations, events, all of which is going virtual. But still, many people will come out, will be celebrating together. What is your advice to all those who will be coming out today and the rest of the summer?
Well, I think, yes, this year is going to be different. Virtual is best, but certainly stay within your household or family bubble, if you like, is still the best. Boat together in your bubble, canoe within your bubble, barbecue within your bubble is the safest. If you're interacting with others outside your bubble, remember some very basic core principles, which is keep the physical distance between those who are not in your household and your immediate social bubble. Wash your hands frequently. Of course, wear a mask, as I said, if you can't physically distance. And definitely do not go out and celebrate if you're sick. Stay at home if you're sick to protect everyone else.
Doctor, there's an interesting development that's taking place south of the border, and I want to speak with you about that. Our neighbors are stockpiling remdesivir like we've never seen before. What do you make of this development, and what can this drug really do?
Well, I think there's some initial evidence that remdesivir is not for people with mild illness, but it's shown some improvements or reduce the days to recovery in those who are generally hospitalized, who are on oxygen or in the intensive care unit. And there has been an application to our regulator, Health Canada, for this drug to be approved in Canada. Right now, the evidence is still evolving, it's still being reviewed. But I think right now in Canada, the safest way to use remdesivir is in the context of a clinical trial, and there are those available, they're registered in Canada.
Very important advice there coming in. And Dr. Tam, before we let you go, I have to ask you, today's Canada Day. How is your day looking like? What are you going to be doing?
Well, I am going to still do a bit of work. But I'm going to try and go outside safely. Again, sort of, outside I think is best. The thing that I love about Canada when I arrived in Canada was the great, amazing and epic outdoors. So sort of go and have a walk in a park. I'm a runner. I'm going to try and do a little bit of exercise if I can, and practice what I preach, really, to maintain all of those good public health advice. But I do want to wish everybody a happy and safe Canada Day, go out as safe as you can. And for those who are our francophone people who live in Canada, bonne fête du Canada, ensemble, gardons le cap, stay on course.
Wonderful. Dr. Tam, it's been such a pleasure talking to you, and thank you so much for all that you've been doing for all of us and the country, and have a great day ahead as you celebrate Canada Day. That's Canada's Chief Public Health Officer, Dr. Theresa Tam. Appreciate your time, Doctor. Thank you so much.
Thank you.